What is mpox and why is this outbreak so concerning? A nurse verifying samples for the child declared a suspected case of mpox in the Democratic Republic of Congo in July. CNN. The World Health Organization on Wednesday declared the ongoing mpox outbreak in Africa in global health emergency, the highest level of alarm under international health law. It follows the public health emergency declaration that Africa Center for Disease Control and Prevention made for the continent Tuesday. A deadlier strain of the virus, clade IB is spreading quickly in the Democratic Republic of Congo and has reached at least 4 previous unaffected countries in Africa. The risk of additional international spread is very warning. WHO Director General Tedros Adhanom Ghebreyesus said. It was anonymous that the current outbreak of mpox, upsurge of mpox, is the extraordinary event, said Dimi Ogoina, chair of WHO's Emergency Committee. What we have in Africa is the tip of the iceberg. We are not recognizing, or we don't have the full picture of this burden of mpox. Experts around the world are monitoring the situation closely. For now, the current risk to the United States is thought to be low. Here's what to know. What is mpox? Mpox, formerly known as monkeypox, is the viral disease related to the now eradicated smallpox virus. It can spread through close contact such as touching, kissing, or sex, as well as through contaminated materials like seat, clothing, and needles, according to WHO. Initial symptoms are typically flu-like, including fever, chills, exhaustion, headache, and muscle weakness, often followed by the painful or itchy rash with raised resins that scab over and resolve over the period of weeks. What is different about this outbreak? Mpox is characterized by two genetic clades, 1 and 2. A clade is the broad grouping of viruses that has evolved over decades that has distinct genetic and clinical differences. Clade 2 was responsible for the global outbreak that was also declared to be a global health emergency from July 2022 to May 2023. But the new outbreak is driven for clade 1, which causes more severe disease. The subtype that is responsible for most of the ongoing spread, clade 1b, is relatively new. Because of the number of different factors, 1b has emerged as the new mutation that is adapted to humans, said Dr. Daniel Bosch, Senior Advisor for Global Health Security at FIND, a global non-profit focused on health equity. The virus is often transmitted from animals to humans, he said, but once a mutation adapts, it can be transmitted by humans and drive a large outbreak. Clade 1b is new and concerning, but the current situation is confounded by multiple overlapping outbreaks. We are not dealing with one outbreak of one clade. We are dealing with several outbreaks of different clades in different countries with different modes of transmission and different levels of risk, Tedros said Wednesday. How dangerous is it? Some outbreaks of clade 1 mpox have killed up to 10% of people who got sick, although more recent outbreaks have had a lower death rate, according to the U.S. Centers for Disease Control and Prevention. The fatality rate for clade 2 is less than 0.2%. Certain groups, including infant People with severely weakened immune systems and pregnant women are more likely to have more severe infections. Still, surveillance of mpox is quite incomplete, and there's much more to learn, Bauchi said. This is the virus that is in environment and presumably maintained in small mammals in Africa, and we don't have the proper dia- diagnostics, really, he said. It is not necessarily hard to diagnose mpox infection when you have a laboratory right next to you, and skilled laboratory workers and technology. But of course, most of these cases are often seen in very rural areas. To trying to get a sample and get it to a laboratory is the difficult thing. Our understanding of transmissionability and fatality risk may be skewed by limitations that tend to detect only the most severe cases, he said. Regardless, increased spread raised the public health burden and the number of individuals affected. This disease that causes a lot of pain and suffering, a lot of fear, a lot of panic, Bauchi said. Where is mpox found? For decades, mpox had largely been found in Central and West Africa. The vast majority of cases of clade 1 were from Central Africa and the Democratic Republic of Congo, and the vast majority of clade 2 were from Nigeria. In 2022, concern grew when cases started spreading in Europe and in North America. Broader international spread is a key reason why mpox has been declared a global health emergency. But the geographic pattern of the current outbreak is different than it was during the outbreak 2 years ago. Now, mpox is reaching more countries in Africa that had previously been unaffected, while the vast majority of cases are still concentrated in the DRC. Cases have also been reported in at least 13 countries across the continent, according to the Africa Centers for Disease Control and Prevention. And on Thursday, Sweden confirmed its first case of clade 1 mpox, marking the first time it had been found outside Africa. We've all heard a million times that no one's safe till everyone's safe, Bauchi said, especially with how common international travel is. There are many reasons to be concerned and jumped on it early. There's also an element of equity and human rights, he said. The Global Health Emergency Declaration from 2022 set a precedent and similarly concerning patterns of transmission across multiple countries in Africa deserve as much urgency and attention as spread in high-income countries. How can the spread be contained? Vaccines to protect against mpox are available, but they are not widely accessible in Africa. No cases of clade 1 mpox have been identified in the United States, but the US CDC recommended last week that people in the US who were exposed to or at high risk of catching mpox should get vaccinated. The Vaccine Alliance, known as Gavi, has up to $500 million to spend on supplying mpox vaccines to countries affected by the disease outbreak, including the Democratic Republic of Congo and the surrounding countries. Beginning in 2026, Gavi will establish a global stockpile of mpox vaccines similar to its existing stockpiles for cholera, Ebola, meningitis, and the yellow fever vaccines, a news release detailed Thursday. But WHO emphasized that vaccines are only part of the response. Containing the spread will also require increased surveillance, diagnostics, and research to fill gaps in understanding. The organization has signed off the emergency use listing process for both mpox vaccines and developed a regional response plan requiring $50 million, with the $1.5 million released from the WHO contingency fund for emergencies. Half of a million doses of vaccines are in stock, and another 2.4 million could possibly be produced by the end of the year, according to the team UN of the WHO Health Emergencies Program. The DRC and Nigeria will be the first to receive these vaccines. African Regional Emergency Director Dr. Abdul Salam Gueye added. CNN's Maya Davis and Caitlin Danaher contributed to this report.